So Veronica, we're ready when you are.
Yeah, we reached 1,000.
Hi Veronica, do we have people in now?
Mhm. Slowly, she's entering them.
Okay. Good morning, everybody. So we are so happy to see you all this morning, and just want to make sure that we welcome you. We're going to give it just a moment or two. As you may be able to see from the participants, we have quite a few people here this morning, close to 1,000, right at 1,000 actually, which is the cap actually for this meeting. So we are so pleased that you're here, and we're looking forward to giving you this presentation this morning. So as I mentioned, we'll give it just a minute or two to allow our moderator to bring everyone in, and so that we can go ahead and get started. But thank you so much for taking time out of your morning to join us. And I also see that some of you are going ahead and putting things in the chat box. Let us know where you're at. Let us know where you're from. We'd love to see where you're representing all throughout the state. And again, if you're just joining, we are still entering people into the meeting. We have 1,000 people that are in the waiting room being let in very quickly by our moderator. She's doing an excellent job. So we'll get started once we've allowed everyone in for this morning's meeting. Wow, I'm looking at the chat, and it's really impressive where all you guys are coming from. It really, truly is all throughout the state. That's so remarkable. Thank you so much again for joining us this morning. So good morning, everybody. We're getting close to having everyone here with us. Thank you so much again for coming and being with us this morning for this extremely important presentation. We are very much looking forward to this and making sure that we have everyone ready for COVID vaccination as much as we possibly can. So certainly, we just want to go ahead by welcoming you. We are a little bit delayed. My apologies. Again, we have about 1,000 people, coming into this meeting, which is a bit above average, of course, for us. So we are very happy to have you all here. So if we can go ahead and move to the next slide. So just again, welcome to you guys all this morning. Just a few housekeeping notes. We are muting all lines for this meeting, given especially that we have 1,000 people joining us. If you have questions, please type them into the chat box. We do have people working within the chat box with questions that are trying to answer those as quickly as possible, and making sure that we answer those. I will say, given the entirety, the large group that we have this morning, if we don't get to your questions, we will certainly work to answer those as best as we can. And we'll have an email where you can reach us for additional questions if you have them. Also, feel free to start or stop your video. If you have a video on your device, you're welcome to go to the 3 little dots on the right-hand corner in the square where your name is, and you can unshare your screen there, or unshare your video there rather. So next slide, please. So I want to go ahead and introduce us. So first of all, we have Lean. She is from our COVID-19 MRC Medical Surge Coordinator. And my name is Megan, and I am your Virginia MRC COVID-19 Coordinator. So we work together as a team and have been working alongside your individual local MRC coordinators throughout this COVID pandemic response. So next slide, please. So what will you learn today? So after this session, we hope that you guys will have learned state and local dispensing systems. We also hope that you have learned point of dispensing operations and structures. Also, we're going to review over vaccination distribution and what we know up to this point, as you know that this is an ever-changing situation. And then we also will go over roles for volunteers during mass countermeasures operations. Mass medical countermeasure operations. So we can go to the next slide, which is we're going to first start off by looking at the strategic national stockpile and talk about point of dispensing, or POD, through our overview. And I'm going to hand it off to Lean to introduce herself and speak a little bit more about this.
Good morning, everyone. Thank you so much for joining us this Saturday morning. I'm going to make it quick and easy as possible. So some of you might already attended something similar to this, so some information might be overlapping. So if you bear with us, we'll try to make it as fun as possible. So I'm going to give a little bit of overview about the strategic national stockpile, and then we go into the point of dispensing, which is POD. You're going to hear POD throughout this training today. I'm trying to hit next. All right, so what is the Strategic National Stockpile? We call it SNS. So the Strategic National Stockpile is the nation's supply of life-saving pharmaceuticals and medical supplies that managed by the USA Department of Health and Human Services. So HHS actually in charge of the stockpile, and their ASPR, which is the Assistant for Preparedness and Response. So at the SNS is actually caches that is strategically located in secured warehouses across the United States. So it's located throughout the United States, where it can be easy deployed. If it's next to an airport, next to a railroad, whatever it is, to be deployed as fast as possible. So this is an actual warehouse. The picture that you see, this is actually one of the warehouses where we have the Strategic National Stockpile. What does the Strategic National Stockpile has? So it has a personal protective equipment, PPE. It has ventilators. It has airway management, and it has a lot of pharmaceuticals and testing supplies. These are actual pictures from some of the warehouses as well. So this is an airplane. Some times ago, I think during 9/11, they deployed it by airplane. Hurricanes, during Hurricanes Katrina, all these different big national disasters, the wildfire, were normally deployed by airplanes, sometimes by trucks. It depends where the warehouse is. And we use, as you can see, we use the National Guard, we use volunteers to help us. So it's a mix of people that they help us with these stockpile. So what's the difference between the role of the state and localities? At the state level, we normally receive and pack and store and secure those stockpile. We secure it and then distribute to the local jurisdiction and other state government. For the local, they normally receive that, they secure it, they dispense it to the public. So we receive it at the state level, but the local is the one who actually dispense it to the people. Another role that both the state and the local do, there's so many roles from planning to training, but here I kind of put just the stuff that it's kind of important. So the public information and communication, it's also important. You see all these messages that we put out to the public. There is a vaccine. We tell them about the vaccine. We tell them all the information that they need to know. So now we're going to the point of dispensing, POD, as I said. So here for the next slides, we're going to understand public health emergencies that we require actually POD activations. We're going to describe the types, the purpose, and the functions of PODs. We're also going to talk a little bit about PODs operation, the different groups or different function groups, your roles and responsibilities. What is a POD? A POD, it's a point of dispensing that is fixed, identified. Normally, it's in a public facility where medical countermeasure, MCM, are given to the people to respond to a public health threat or emergency. So it's actually been fixed and identified by the local health department. They know where it's going to be the POD. So when we say, go ahead, activate, they know where to go and set up that POD. So the primary goal of a POD is actually to triage and medicate. The secondary, we also record keeping and behavior, and also we want to make sure that individuals are not sick. So this is a countermeasure. We make sure that people are not sick before they get sick when we know there is a threat. So what's the difference between PODs and a clinic? A clinic is normally, there is a doctor, the medical history, they do your exam, and it's individually focused. It's time consuming, and then you be transferred to a traditional healthcare setting. For the POD, it's a little bit different. We don't exam no one. It's population focused. We want to give as much pills or as much vaccines to the people to protect them. And we normally do it as quick as possible. So within 2 days, normally we set up PODs and dispense to the whole population. And as I said, it's community-based, non-traditional healthcare setting. It could be in a church, it could be in a school, it could be in a parking lot. We just want to get as many people as possible, as quick as possible to get them medication or vaccines. As I said, there's two different type of PODs. There is the medical POD and non-medical POD. The non-medical, the two different things between them. The non-medical, normally we distribute oral antibiotics, and for the medical, we distribute vaccines. The other different, for the vaccine, we normally require license because not anybody can give vaccine. For the pills, everybody can do it. Everybody can pass pills. And then for the pills, also we dispense it to the head of household. For example, the father, the mother, somebody can come from the household and collect the money collect the pills for everybody in the house. For the vaccine, apparently each individual has to come into the POD to get vaccine. So some of the policy, we normally don't allow media to access the POD. We give them some rules and they normally follow the law. And actually, we don't require no ID, your full name, date of birth, the address, and some information might be required sometimes. It depends from a POD to a POD. So here's a question for you guys. What's the difference between a closed POD and an open POD? If you don't mind answering that on the chat, and we'll just get you a little bit thinking here.
Yeah, I'll report back what we see in the chat. So far, we don't have answers, but it says, let's see.
Yes.
Bridget, we see closed by appointment only. And
Okay.
yeah.
Any other try?
There's public versus private, and I apologize, it's going pretty fast, so I can't report out the names. So targeted group versus walk-in.
Yep, I think you're close. You guys are all close. All right. So the closed pod or private pods, we normally, it's for partners, and they use their own resource to organize and set the pod. The open pod is open for everyone, and there's no restriction. Anybody can come in. We can put it in the radio, we can put it in the news, we can put it and say, okay, this high school is going to be open for a pod. The other thing, so let me give you an example of a closed private pod. So closed private pod, for example, the hospitals. People work in the hospitals. They want to be vaccinated. They want to get their pills. So we normally have an agreement with hospitals. We send them the pills or we send them the vaccine, and they vaccine their own people, meaning they can vaccine their own employees, not the patients, their employees, their staff. Everybody works at the hospital, so they can take care of themselves, and that also will ease the stress on us. And we don't have to vaccine everybody or give the pills to everybody in the community. Another example, jails, correction facilities. All of these facilities, if we send them their pills or we send them their vaccine, they can take care of their own people. They don't have to come outside to the public. Another example, big companies, like for example, Dominion Power, we have an MOU with them because we consider them essential employees. So we send them their pills, we send them their vaccine, they can vaccine their own people and take care of their own people. Also military bases, we have MOUs with military bases around the state. We send them the vaccine, we send them the pills, they can take care of their own people. So this is the difference between a closed pod, a private pod. Here, as I said, these are some examples: government, department, jails, private hospital, churches, big companies. Open pod, we normally have it in schools, gymnasium, community centers. You've seen guys probably drive through pods, and we have mass vaccination clinics. Sometimes we send it to the free clinics and they can do it as well. And we have some MOUs with some of the biggest pharmacies to have it as an open pod. So we send the vaccine to the pharmacy, public can go in and just get the vaccine for free, or for free, yeah, because that's during a public health emergency. So dispensing scenarios, what we normally activate the dispensing operation. If there's a national disaster, as I said earlier, we have hurricanes, and then there is also a novel or emerging infection disease like the COVID-19, and man-made incidents, bioterror attacks, small or large scale. As I said, we deployed through 9/11. We also, the anthrax, remember back in 2001 during DC, we also had to dispense some medication as well. Next.
So yeah, and then also someone in the chat mentioned MOU, and that does stand for Memorandum of Understanding. So thank you for pointing that out.
I'm sorry. we use those terms all the time thinking that everybody know what it is. My apologies.
Oh, no, you're fine. I was just making sure I mentioned that.
Yeah, thank you. All right, so what's some of the public health emergencies that might require pod? As I said, anthrax, plague, smallpox, pandemic. So I remember we had a big outbreak in one of the universities here in Virginia, and it was a smallpox outbreak. So we had to kind of also deploy some medication, and we kind of give medication to the whole campus and everybody working that campus as well. So we do varieties. Sometimes a small incident, sometimes a large incident. So it depends. So what's responding to public health emergency? It's the ability to provide medical countermeasures in support of treatment for prophylaxis to identify population in accordance with the public health guidelines and recommendations. These are some of the pictures, some of our pods. All right, so what's the response time? This is just a general incidents from incidents, it depends. Like right now with COVID-19, we're waiting for the vaccine. Once it's ready, they'll ship it to us. But for this one, for example, here, this is an incident, and incidents happen. The decision, normally incidents happen at the local level. So we don't understand, something happened at the local level in one county, in one city, something happened in one state, and then the decision will be made to dispense. There is a lot of there's a lot of talk in the background. There's a lot of phone calls. You can imagine from the federal to the state. I mean, so it's a lot of stuff that we do behind the scene. And then we start mobilizing. We send alerters to volunteers and to staff to get ready. the shipment would be deployed to our warehouses. We receive it, we unpack it, we transport it to the pods or to the health departments. And sometimes it happens in 48 hours. Some of our plants, all of this stuff, it needs to happen within 2 days from the request to receiving the shipment.
Eileen, can you slow down just a little bit?
Sure.
In speaking, thank you.
All right, so what are the initial actions? It started the health director. As I said, it started at the local level. For example, Alexandria Health Department director decided that there is an incident and they need that. They need a medication, they need vaccine. So they identify that. They request the support from all the agencies that they work with, from law enforcement to even the Department of Education, because they're probably going to use a school, and they're going to determine the dispensing protocol. Either they're going to dispense it to the public or it's just a close incident that they need to dispense it to a very small identified population. So the pod operation, the primary goal, as I said earlier, triage, medicate, and actually educate. We want people to understand what's going on. We want them to be aware of the information that is out there. So we give them the information, and then the operation normally starts at the beginning. We greet and screen them when they come in. We give them form to fill out, and then we dispense medication or we vaccinate them. This is as simple as it could be, the pod. So maybe before I start that, if there's any questions in the chat that I can take.
So one question that came in was specifically if MRC is paid or unpaid. So volunteers are typically unpaid, but we do have some times and availability when you're doing extraordinary work and where we ask, whoever you're volunteering for to help pay for part of your travel expenses, et cetera, if required. So to that end, there may be some support in terms of that, but this is primarily volunteer.
Thank you, Megan. Any other questions?
There was a question about, do we anticipate a 48-hour turnaround being the case for mobilizing COVID vaccinations? And we can certainly get into that a little bit more, but if you wanted to kind of speak a little bit to that.
For COVID, I mean, we don't know. It might be quicker than that, and it might be a day or two. So, but we will get to that later on. I think, Megan, you're going to cover that part, right?
Yes, definitely. We'll go over that. But certainly, as Lean said, there's still some uncertainty about COVID vaccination, but we'll get into that later on in the presentation.
Yeah. All right. So now we're going to move into the roles and responsibility during a pod operation. So first of all, there is a pod leadership or pod command staff. I just want to mention that those roles, the names might be different from pod to pod. So from jurisdiction to jurisdiction, they kind of change the name, but the responsibility is similar or the same. Sometimes one staff can play different roles or can have different hats. So just bear with me. You might see those names in different if you've been to a pod operation before. So this is just to give you an overview overall what we mean by the command staff and pod leadership. What they do, the leadership, they manages, coordinates, and consults on overall MCM pod side functions, including the operations, liaison, public information, security, safety, planning, logistic, and administration. So they're basically in charge of everything for the pod operation. Making sure if there is a public information, if there is a media, they need to take care of that. If it's a logistic issue, they need to take care of that. The planning, the security of the pod, the security of the people, the safety of the people working, the safety of people entering the pod, the administrative part of it, everything that include these are the leadership in the pod. And they normally report to the emergency planner, which is each health district has an emergency planner, or they can report directly to the health director of that health department. So here's some of the responsibility for the command staff. I'll show you the difference between a command staff and a leadership in a little bit. So the command staff responsibility, as I said, they direct all dispensing operations. They coordinate with partner agencies at the pod sites. For example, they have the pod in the school. So they probably coordinate with the administrative at the school. Maybe they will coordinate with the police at the school, the local jurisdiction police department, the fire department. So they'll have that coordination and the setup in the pod. If there's any issue with the site, they decided that they're going to change the site last minute. They're going to have different gates. So all that coordination, that's the responsibility of the command. As I said, they communicate also with HDOC. HDOC, it's Health Department Operations Center. So during operations like that, we have an operations center. Some people are coordinating from outside, from the health department, to make sure things are going smoothly and as quick. So and also, so that's what the command staff does. He or she coordinate with the health department operations center, also the EOC, which is the Emergency Operations Center at the state level. Act as a resource for PAD staff. So if you have a question, if you have an issue, you go to one of these command staff. They manage small incidents that occur during dispensing operations. There's an issue here and there. They're the one who to go to for that. Also, they ensure the safety of pod staff and clients. Your safety and the staff safety and the people coming to the pod is our number one priority. Here I put the safety officer. Some pods, they have a safety officer, some pods they don't have, or they call it biosafety. They're normally part of the command staff. They monitor the clinic operation and advise the clinic points of dispensing supervisor in all matters relating to safety, including the health of safety of clinical personnel and clients. Also, they might assess and anticipate any hazard or unsafe situations. The spy safety or safety officer, normally they have a background in safety. We like them to have that background so they can kind of see if there's any issues going on in the pod. And they might report directly to the pod manager or command staff or the clinical supervisor. So here's the unit leader or supervisors. Their responsibility, the safety, as I said, the welfare of our staff, overseeing the operation of each unit. So each unit, they have a unit supervisor or unit leader, giving briefing and update your staff. So if you're doing the logistic supervisor, logistic unit leader, he need to give you an update, a briefing, what do you need to do, all that good stuff. Also, they ensure staff receiving adequate breaks and rest and look for any PPP exhaustion and ensuring staff record times are appropriate. So here what a pod looks like. Maybe if you see a picture, it makes more sense to you. So you see the pod manager and you see the safety officer or biosafety officer. Their names sometimes can change. They report directly to the pod manager. You can see here all the unit leaders, logistics supervisor, clinical supervisor, critical supervisor, flow control supervisor, support service supervisor, or they can call them unit leader, they can call them supervisor. So it depends from pod to pod. But this is how it looks like. The instructor. All right, so the role of vaccinator. Very simple, prepare and administrate vaccine to clients. And this person, you'll be probably reporting to the pod manager directly or the unit leader or the clinical supervisor. The job description of the vaccine supporter. We call them vaccine supporter or medical evaluator or anybody who's sitting next to that vaccinator person that they help them. So they ensure clients receive the proper screen and medical evaluation protocols. They collect and process all patient registration and evaluation forms. They record the time in and out. And this person might be reporting to the pod manager, unit leader, or clinical supervisor. This is an example. You can see here the clinical supervisor, you can see the vaccinators here, and you can see vaccinator assistant or medical evaluation. Sometimes it could be one person doing the two jobs. Sometimes it could be 2, 3. I mean, it depends how big the pod is. And as I said, they report to the clinical supervisor report to the pod manager, or sometimes they can report directly to the pod manager. Here, a question for you guys. So can you think of a support role or roles to the pod mission? You've seen already some of the roles that I've mentioned. Can you think of any other roles that you can think might be beneficial to have in a pod operation? I'll give you guys a minute. Think about it. And you can report it. You can answer it in the chat.
Yeah, so we've got some, let's see, traffic coordination, data entry. Someone said recording, food greeter specifically, and language interpreter. I think I'll stop there. There's a lot coming in.
Okay, yeah, these are all correct. These are all correct. Nice. Here today, we might not cover all of them, but you guys are right. There is so many roles that we can support this mission. So let's start with the admin support. So we have vaccine controller. That's what they can call them: fillers, screeners, assistants, floaters, runners. I mean, there's so many names for that particular admin. So what they do, review screening forms, assist the vaccinator by preparing appropriate type of vaccine. They might also be, as I said, reporting to the pod manager, support service leader, flow, traffic unit leader. Depends on their position. So this is the greeter. Somebody already said that, or the screener. So they're probably by the door. They greet the clients. They take temperature, symptoms. If somebody's ill, they need to direct them outside so they can go and seek medical care to a near hospital and we normally have an ambulance, one or two outside, just in case if somebody got sick but we normally, if we see somebody visibly sick, we try to send them outside so they don't affect the rest of the population. Also, they address needs such as physical language services. So if they feel like there's a need at the front, they need to kind of let the pod manager or the person in charge of that, knowing that there's a physical, somebody needs some assistance. So this is our form. Oh, my bad. The form distribution review unit, the responsibility to review the form, record time, hand out the screen form so each client can fill out, answer any questions in regards to the forms, review the form, and as I said, record time, monitor for clients who require additional assistance. And normally when you work in that capacity, we make sure to train you what the form is, what questions you can get, so we're not just going to give you the form and be like, okay, go ahead, and that's your. No, we make sure that you understand each question in that form, the intake form. All right. Pretty slow to go next. All right. So flow traffic control. Somebody mentioned that already. We have a unit also. They can control the traffic, especially if it's a drive-through pod. If it's not, also we have people, coordinating that. They guide the clients through the pod, direct clients with outstanding questions. If they have something, prevent arriving clients from entering the pod through an exit door. They kind of manage the traffic overall, and then address needs as well. So here is I like to bring this picture every time so you kind of see where each role is located. So you can see here the flow control, greeter, screener, flow inside, flow outside, critical supervisor. You can see they kind of in charge of all the forms. Sometimes you have like 3 or 4 people. One person will make sure the form is filled, another person will look at the form, review it, and then a third person kind of confirm that everything is correct in the form. All right, so interpretation, somebody also mentioned that, and special accommodation. We hope to have somebody there that they can assist non-English speaking clients with understanding the information and process, interpret information between the pod and staff, and also identify any accommodation needed for vulnerable population, children, elder, access and function needs, hearing and visual impairment. So anybody that we feel like they need help, we hope that person can find the right, correct accommodation. This person might be reporting to the support services unit leader or directly to the pod manager. Here you can see the support services all the way to the right, an interpreter, education outreach, counseling. It depends from a pod to a pod. Sometimes we get more than one support services, sometimes 2, and it depends on the community too. If you feel like this community needs a lot of interpretation, they have a lot of foreign language in the area, so it depends. So now we're going to pod demobilization. What we mean by that that. So the operation good, the shift is ended, we need to demobilize that pod. So at the conclusion, each pod manager will secure the SNS or MCM inventory. They notify the team, different team leaders, that this is time for pod demobilization. The team leader will hold debriefing, we call it, or hot wash, with the team to discuss success and areas of improvement. Please, when you get to that part, participate, talk, let them know where you're concerned, if you've seen something, because we always learn from these spots. So we love to hear from everybody, the staff and volunteers. Don't discourage yourself from talking or speaking during these hot wash or debriefing. As I said, we learn. Every part is different. Every operation is different. We learn, and we constantly wanted to improve. Then the general pod staff will assist pod facility in demobilizing or setting a pod for follow-up. Sometimes the shift is ended, so we demobilize for a 12-hour shift maybe, and we're starting a new shift the next day. So this is what it is. All right, I think that's all I have. You guys have any questions?
Eileen, we've had several in the chat, so let
Okay.
me, let me go to those real quick. And I apologize, I tried to get some of them, but we've had a few. So one that came up is that you mentioned no ID was required in an open pod. Will we have more documentation short of filling out a yellow card?
So the no ID is normally in a scenario where we dispense pills, honestly. So if we dispensing antibiotics, that's when we don't care for ID. We just want to give pills to the population. We want them to get not to get sick. For vaccine is a little bit different. We need the information, especially now, for example, COVID-19, there is a second dose. So we need this information also for any that diverse interaction. If somebody getting sick from these vaccines, we want to get the information in the system. So for the vaccines, actually, we're going to ask for IDs and we're going to ask for information.
And then another question is, will there be security available in case there are disturbances?
Security is always available. Sometimes we rely on, as I said, let's say we work in a school, we rely on the police at the school, and we definitely have agreement with all local law enforcement to help us with pods. From the minute that we receive those SNS or MCM at the warehouses, the state police is helping us. We move it to the locality will take care of it. So it's actually, we have a big security plan that we have with all state, local jurisdiction, sheriff departments. Everybody is aware of the SNS. Everybody's aware of MCM. They know their roles. We meet with them. They're always going to be a security person at the pod.
And then there was some questions about how do you plan to separate asymptomatic people and avoid a super spreader event. We'll get into that a little bit later on, but Lene, if you want to kind of speak a little bit about how we've begun incorporating in infection control ambassadors. I know we didn't speak about that today, but that's one consideration that we're having as we go into more public pods.
Yes, there will be somebody there that they're trained to pick those people if they feel like somebody's sick. We also, as Megan said, we're going to have the infection ambassador. Somebody will make sure that the areas are cleaned and after each person pass by. So we'll make sure to take all the necessary measures to avoid any, to avoid the public getting sick from exposure.
And then I think one of the final ones, and again, I'm going to hold the vaccine related questions towards the end because I think that I'll answer some of those in our presentation. But how required is the ID? If someone doesn't have a driver's license, what alternate forms are usually accepted?
So remember, this is a public health emergency. Our main mission is to protect the public. So if somebody can come in and they said they don't have an ID, our responsibility is to make sure that they're not sick and they're not going to infect anybody else. So we'll give them the pill or we'll give them the vaccine. As long as we get some information, their names, their address, whatever we can get, we'll make sure to get them because that's our mission. We want to make sure the public are safe and well taken care of.
And then who is responsible for getting areas to participate and sponsor a pod?
What do you mean by that?
I'm guessing that the question is relating to closed pods. So maybe who is responsible for creating both closed pods and how that kind of works in terms of how the designation is between who can hold a closed pod and an open pod. It wasn't completely clear, but that's how I'm reading that question.
I'll try to answer it then. So at the state level, we have somebody who works with those big companies, big corporation, government. They work with them we actually reach out to them because a lot of them, they're not aware of this. So we go, we set a presentation. For example, I was one in the presentation for the Me Empower. We went, we told them about it. So we go around the states, military bases, different companies, government agencies, we go to them and talk to them about hey, won't you want to take care of your people so they can come to work, they can take care of their family, because once you go to those close spots, you can take care of your family too, so it's not just the staff. So somebody can go take the pills or they can bring their family to that pod as well. So we normally that's how we sell it to them. And then we go through the MOU process, as I said, which is it's a very simple process. We just come to agreement. Hey, when there is a public health emergencies, these are the things that you need to do. This is how the pod needs to be set up. We actually deliver training like this to them. This is how the pod needs to be set up. This how many people you need to have as a staff. You need to hire nurses to help you with if it's a vaccine, you need to hire this. So we kind of tell them a plan, or we help them to plan a pod operation. So similar to what you see now for the public, they have their own plans as well. We kind of review the plan and review the MOU with them every year. As I said, we have somebody designated for that. We're not the one who decide who can be a closed pod, who can be an open pod. They come to us, or sometimes, as I said, we go to them and let them know here, this is an option. If they want to take it, they can take it. If not, at the end, it's up to them. I hope that I answered that question.
Yeah, definitely. And I think specifically for COVID vaccination, and we'll get into this a little bit, but those closed pods, due to the limitations on the amount of vaccine available right now, will be primarily for those who work in those areas such as hospitals, long-term care facilities, et cetera. We'll be getting into that a bit more. But as we have more vaccine, of course, the things may change, and we expect them to. In fact, we hope for them to as we have more and more vaccine available. There was a question about fingerprinting. For MRC volunteers, we only request that you fulfill a background investigation. No fingerprinting is necessarily required. I saw that somebody mentioned that they had been fingerprinted. I don't know that was necessarily for MRC itself. However, it may have been a locality need for that specific health district. But for MRC in general, we do not require fingerprinting. But I think that gets most of the questions, Lean. We'll be sure to check towards the end of the presentation as well to make sure we didn't miss anything. But I think that was great. And thank you so much for presenting on that.
Thank you, guys. Thank you. All right.
All right. So I'm going to kind of put on my presenter hat for a moment. I've been in the chat box, so thank you for all the questions. We're going to go forward now into tips and training for pods as well. And then if you can go to the next slide. So when we are talking about pods, there are some tips that are really helpful specifically for pods. We really, first and foremost, really encourage you to be proactive, get into the mix, find the problems before they start, and be a source of the solution. So pods are very interactive, as Lean mentioned before. A lot of things can change throughout the day when you're working in one. So just making sure that you're being well aware of your situational awareness so that you can assist in different ways and means. Also, make sure that you pay attention to your staff's need. If you're a pod manager or you're in some type of leadership, make sure that you're that they're drinking water and that you're drinking water and that you're taking time to get food and you're taking time to use the restroom and take breaks. You know, there are a lot of moving parts when we talk about pods, and we want to first and foremost make sure that those that are members of the pod are taking care of themselves. So make sure that you're being your own advocate and you're the advocate of those who you may be managing throughout the pod. Also, make sure that you're being transparent. If you don't know the answer to a question, be sure to be honest and don't tell someone that you do. It's important that we all know that none of us have all of the answers at all times. That's why there's so many different roles in these pods. So just make sure if you aren't sure of something, someone else there should know that piece. And you know, you're welcome to find out and make sure that you're directing people in that manner. Also, don't be afraid to get your hands dirty. Do the work, and if you need to sit down or take some time, you know, to take a break, please by all means do that. Just make sure that you're checking in with whoever is in your chain of command for the day. And then also make sure that we're being respectful and honest with those in both the public and those that you're working with around you. Also, in terms of safety, thank you, Lean, just make sure that you know that your responsibility at the pod, first and foremost, is to be safe and responsible for the safety of yourself and the safety of others. And health and safety is an integral part of pod management. So we want to make sure that that's first and foremost at every pod. Next slide, please. So when we talk about safety specifically, feel free, if there is a need that arises in the event of an emergency, dial 911, please. Provide CPR. Of course, at this time, we're encouraging hands-only CPR or first aid as qualified to do so. Of course, if you're not qualified to do so, find someone who is. And there should be, especially at this COVID vaccination, there should be plenty of people around who are BLS and CPR certified. It does not matter, you know, if you have a million professionals around you or anything. If you need to call 911, please call 911. Also, make sure that you're informing your incident command system supervisor and the safety officer of any kind of injuries or issues that you deem to be safety issues, and make sure that you're also being mindful of your surroundings. If you see anything strange or suspicious or potentially dangerous, like a fire hazard, for example, make sure that you're notifying your immediate supervisor. An incident safety message is developed also as well in the incident response level and disseminated down to each rank of the pod throughout the incident action plan. So make sure that you're aware of all of those safety messages as well. So next. So a little bit of information about potential training. So we are still awaiting some of the vaccine-specific trainings for different vaccines. So we did not include them here today. If you are going to be working on site, say at a hospital, or you're called to work somewhere, you will be receiving that training at the said hospital. Once that training is available, we will for sure make sure that you're aware of it. And we've already been getting some training specifically out to local health districts as well. But these are some just general overall trainings that you can go ahead and take that can really help to fulfill your needs for different trainings. So of course, you are essentially in a abbreviated pod training today, but there is a pod essential overview training course that's about an hour and a half long that's at the link that's provided. Also, there's some questions about mental first aid and psychological first aid. We do encourage that training, and it can be very beneficial. As Lean mentioned, there are specific roles for mental health assistance in a pod. So PFA, as we like to call it, or psychological first aid, that training is available here as well, and that link will be provided in the slides. Next slide, please. So now we're going to get into the vaccination itself. So this is where I think a lot of your questions have come in. I'm going to give a brief overview, and then we're going to have some of our MRC volunteers themselves give a bit of their own participation experience about working in a pod, both from a medical and non-medical side. And then I'm going to, as they're working on that, I'm going to be taking up some of the questions that I see in the chat about the vaccination and working to answer as many of those as I possibly can after they speak. So for COVID vaccine, mass vaccination. So as you guys all know, there are many, many plans underway at the federal and state levels. Finalization of specifics is dependent on the approval of the vaccine. So we updated this slide even as of this morning because it is a constantly changing situation, as I'm sure you're well aware. So the recommendation by the ACIP was given on 12/10, and that's a group of doctors that meets to review all of the data and give a full-throated recommendation on whether or not the vaccine has met quality standards, et cetera, needed to authorize what we call an emergency use authorization. The Pfizer vaccine is the one that is being reviewed as of right now. And this morning I was made aware that an EUA, or an emergency use authorization, was given by the FDA. So there are a variety of different pod models that can be utilized, as Lean has gone through already. The one that we'll be starting with the most, that I'll talk about in just a moment, is primarily the closed pod model. As you've probably heard on the news, the vaccination will be going first and foremost to hospitals all throughout the nation. And in fact, has already been moved into position probably at this point for many locations in anticipation of the COVID vaccination arrival of the EUA, excuse me. MRC is going to be serving in a very critical role in terms of this vaccine administration and distribution efforts, especially when we come to the public health portion. But we have already begun to discuss requests for potential assistance, even in the hospital portion with MRC, and we'll get a little bit into that. I won't be discussing specifics on that, but just general understanding of what it would look like if you were to be called upon to work within a hospital system. Also, VDH submitted their initial plan for the vaccine disbursement back to the CDC in October, and the Pfizer vaccine of this morning, as I mentioned, has been issued that EUA. Given, just to kind of give you a little bit of background and understanding, there are about 150 different vaccines that have been being studied against COVID. And in order to be approved for those vaccines, as I'm sure you may know from the news, each of these vaccines have to make it through phase 1, 2, and 3 trials. Phase 3 specifically cohorts tens of thousands of people that will follow them throughout a set amount of time to ensure that they don't have physiological consequences and that the trial participant and the vaccination produces what we call an immune response. So as of right now, the Pfizer vaccination and also the Moderna vaccination have gone through much of that rigorous study. Pfizer, of course, being a little bit before Moderna, but we expect Moderna to do similarly if all goes well. Also, given that there will be a number of different vaccinations available in the number of months, it will be important to know how to utilize this variety of different models of public distribution of pods. So some considerations that we've of course heard about both on the news and from different providers of these vaccinations is their considerations, right? So cold chain management. So when we're talking about logistics, making sure that We have good ways to both maintain that vaccine in terms of storage, and then also making sure that we're able to move that out effectively in the window as that the manufacturer has given to us in terms of how long the vaccine is good for. So making sure that that vaccine is not lost or wasted in any way. I would guess that at this point, those vaccines are probably much more valuable than gold. Also, an observation time period for those that are vaccinated. I know that there were some questions there. We are still of course, receiving some of that specific information for the COVID vaccination, but typically for most of our flu pods and other types of pods, we require for people to be in the area for at least about 15 minutes to make sure that they don't have any sort of reaction to the vaccine. Also, follow-up in terms of multiple vaccinations in a series. So as you guys may know, the Pfizer vaccination and the Moderna vaccination both are 2-series vaccinations. So that means that you would come for your initial vaccination, say on Monday, and then 21 days beyond that for the Pfizer vaccine. You would have another vaccination that would arrive and be given at day 21 or later. Again, for the Moderna vaccination, we're looking at a distribution difference of 21 days versus 28 days. So Moderna is 28, whereas Pfizer is 21. And, so we're definitely keeping all of those different parts and pieces in our minds as we are planning for all of these events. And the state plan is also incorporating those in the event. So if Lean, if you or Adrenia is able to put in the chat box the link to the state plan, that would be super helpful as we keep going. And then next, perfect. Thank you, Lean. We can go back to that chart slide. Perfect. Thank you so much. So I know that this chart is a bit small. It can be found, as you can see at the bottom, at cdc.gov/vaccines, and then there's some COVID specific jargon behind that. But this is a little bit about how the CDC plan, the original plan that VDH based our plan on, looks. And as you can see, it's a phased approach, starting with phase 1, phase 2, and phase 3. Now that phase 1 phase is the phase that we are entering now. And I like to compare it a little bit to a roller coaster in terms of our scaling up. So we are on the upswing of the roller coaster at this point, and we are clicking along and trying to make sure that we are ready to get on the train, so to speak, and move forward into the future of COVID vaccination. So as you can see, there is a difference, of course, in terms of the amount of availability for the vaccination in the phase 1 to phase 2 trial phase. I'm sorry, not trial, but distribution phase. When we are looking at this piece, this is where we are scaling up from the hospital distribution, which is the initial portion of what we call 1A, where we are going to be sending out vaccine to hospitals and long-term care facilities who have been most impacted. Now, when we send out vaccine, that vaccine is for healthcare workers, those who are working in healthcare settings. So, people who work in the hospital but may not be hospital care providers. Think maybe a janitor, et cetera. People who still have a lot of contact, though, within that hospital system. Also, they have the highest potential infection there. And then also we're looking at vaccinating those that are living and working in long-term care facilities out in the community. And as we have more and more vaccine, the phase 1A group will grow and grow. So more community doctors will be included more as we go. And phase 1A really is focused on those healthcare settings and the long-term care facilities. Then as we kind of go up the mountain a little bit in terms of our roller coaster, we click along into what we consider phase 1B, which is other non-medical essential workers. So when we're thinking about that, we're thinking of maybe police officers and firefighters. So they are given priority. And then also people at higher risk of severe COVID-19 illnesses. Those include people that are over the age of 65, and then critical populations, et cetera. So that, as you can see, it gets broader and broader as we go. And then when we get into phase 2 is when we have really the largest amount of available doses. And that's when we will begin shifting to that, that very public approach. So this will be more of those open pod descriptions as we were talking about earlier in Lean's presentation. And then as we move into phase 3, there's the potential that this may be, as studies go forward, you know, if we need to have this on a more frequent basis, if it's a recommendation for, you know, let's say it's the recommendation for people of a certain age group to have this either annually or every 5 years, et cetera. As we know more from the science, the phase 3 portion of this will be expected to change. That part we still haven't, the science still hasn't fully bared out, just given the newness of the novel coronavirus. But as we know more, we will certainly encourage vaccination more as needed. So next slide, please. So here are some frequently asked questions. And before I get into these, I know that there's been a lot of questions in the chat about who can vaccinate. That is also something that may change. As of right now, nurses, so RN, NPs, MDs, DOs, and LPNs, and then also physician assistants, and then pharmacists, so nurse practitioners and physician's assistants, and then pharmacists are allowed to vaccinate at this point. Now, there have been some recommendations I'm aware of that have been for non-traditional vaccinators to be included, such as dentists, other people that typically may give a shot, EMS, things like that. At this point, they are not listed as vaccinators, but that could change, especially as the need changes. So we will certainly keep you guys updated as any of those things change, but just know that as of right now, registered nurses, nurse practitioners, doctors, both MD and DO, LPN, so licensed practical nurse, and physician's assistants and pharmacists are the primary vaccination groups at this time. I see a quick question in the chat in terms of student nurses. At this time, no, student nurses are not included in that. But again, if that group changes, that situation may change, and we'll be sure to message that out through your local MRC coordinators. So getting into the frequently asked questions in front of you, is the copy of the Virginia plan available? Yes, it is. And so this is the link for that. Are pod locations already determined? Is there a timeline for when they can take place? A pod location has already been planned, especially for those closed pods, but the locations and timelines are not necessarily yet public. You, of course, know from my speaking about this and the public media reporting that they will be going to hospitals first. So that you do know. But in terms of the other closed pods, there are some closed pods that are planned, but they're not, that information's not yet publicly available. But you would, of course, know if you were a vaccinator or someone who is going to be supporting vaccination, where that would be. So next slide, please. So there were some questions about documentation of the vaccine administration information into the VISS system. So the vaccine information is going to be entered into a system called VAMS. And I believe that stands for Vaccination Administration Management System. And this is going to be able to be used to make appointments, and information will also interface directly into VIS rather, excuse me, VIS. We call it VIS for short. I should probably start there. Also, how long after immunization before there is an immune response, and what is the interval between doses. I talked a little bit about that already. So there's 2 doses for Pfizer vaccine that are 21 days apart at least. Moderna vaccine is to be taken 28 days apart. Both of those 2, which are kind of the 2 primary ones that we're talking about right now, with AstraZeneca being the third, that those 2 primary ones that we're already looking at potentially soon, both have 95% efficacy in terms of their study data. And then also the immune response typically starts immediately, but it's an immune response takes some time to be fully supportive in the immune system. So of course, after the second dose of that, I would say probably around 6 weeks is when that full 95% efficacy rate would really solidly be there, but you would begin to become immune more and more as of that initial dose. So very quickly, I just wanted to also mention that if you have more specific vaccine questions, we're going to answer a few of them after this presentation, but we want to respect your time. And I know that there is so much information to be gleaned from this, right? That we want to make sure that we let you know about a media available session with Juan Cone, I believe. I don't want to mess up his name, but ABC 8 anchor. And he's going to be speaking with the state health commissioner, Dr. Norman Oliver, and many of our other really respected scientists and doctors that work alongside and with and in VDH, the Virginia Department of Health. That's going to be on December the 16th at 7 p.m. So if you have questions, I highly encourage for you to watch that. It's going to be both live and live broadcasted, and then also streaming, excuse me, on those sources below. So with that, we're going to kind of shift focus now for just a few minutes. Next slide, please. And we're going to introduce both Lauren DeAngelis and then Nathan. And they are going to speak a little bit about their perspective and their experience, both as medical volunteers, as you can see Lauren is, and medical and MRC support volunteers, as Nathan is, and they can speak to you a little bit more about their experience with open and closed pods. So with that, I'm going to turn it over to Lauren to kind of go through some of these questions with us.
Thanks, Megan. Again, my name is Lauren DeAngelis. I'm a nurse anesthetist up here in Northern Virginia, and I hope everyone can hear me okay. I've been volunteering with MRC now since about 2017, but with the COVID response that happened recently, I've done a lot more volunteering. But anyway, as far as the background goes, again, I've been a nurse anesthetist for a very long time. I won't tell you how long. But the reason I decided to join the MRC, have always been very interested in disaster type things. And so I wanted to be able to contribute to the community. And I thought the MRC would be the best way to utilize my skills in order to do that in many different instances. So I've also volunteered for the American Red Cross and the American Heart Association in many numerous roles over the years. But again, it was really important for me to become a little bit more involved in the community here in Alexandria, where I live, and MRC was great. So I've been working a lot with the Alexandria Health Department, again, for a number of years. COVID did impact me as well, as I work at a surgery center. So we were closed for several months when COVID hit, and that enabled me to have even more time to volunteer, which was great. So being that I have taken on many roles with the Alexandria Health Department in trying to help them out in any way that I can and garner experience, which has been great for my own personal and professional resume, so to speak. And I've really enjoyed it. So for those of you, if this is your first time, what a great experience, and what an important time for you to be wanting to volunteer and help with this effort that we're going to be undertaking here soon. I've have had many roles, like I said, with the Alexandria Health Department. I've been an instructor for them, teaching people how to don and doff PPE. I've teaching them how to wear an N95 mask properly. I've done a lot of infection control stuff as well for them, including doing some inspections of nursing homes and long-term care facilities, and also the congregate housing. So that's been interesting for me. I've learned how to become an N95 mask fitter, so I do that as well. And I've taken on many roles in the pods, with being a vaccinator, a biosafety officer, as well as a safety officer for in the command group for one of the pods that we've done. So lots of different roles. And of course, I've also done contact tracing for them as well. So how do you prepare to do all that kind of stuff? One says when you're giving anesthesia. Well, the health department has been great in helping us train for these roles and giving us all the information we need to be able to feel comfortable doing them. So that's never really been a question for me. I think really the most important thing for volunteers is just to be willing to fill in and do whatever you can, no matter what your background is. Even the smallest role is so important. So for me to be a flow person or managing traffic, that doesn't bother me at all. I just try and do what I can. And again, it's all great experience no matter what role you have. So don't think that all the management roles are the most important, because they're really not. And it's a lot of the volunteer roles that we do on the side. And this, like I said, the smaller roles really make the pods run smoothly. And it's really important. You'll learn that once you get in there. So again, just being willing and a team player, I think, is the most important thing. I think Megan mentioned, again, just having the different roles and being a team player is really important when you're going to be participating in one of the pods. So as far as the pods go, I think really what I can say is the best way to prepare is to, first of all, know your role and responsibility. And that's the health department's job, to let you know what that's going to be, and for you to be prepared when the pod is ready. And number two, definitely know your chain of command, or those might be reversed. Know the chain of command first, and then your role and responsibility and where you fall in to that. Know the flow of whatever the pod is. If it's a private pod or open pod or in a parking lot, know how it's going to run. Be proactive in trying to figure that out. There's so much information going out when you're getting ready to do a pod. It's just really important for you to be sort of proactive and, you know, sort of get the gist of what's going on and how it's going to work. And also be ready for change. I was talking to Megan before I agreed to do this, and just said, boy, that was one thing I learned. That was a really big lesson, that things change. You could be outside and all of a sudden it starts to rain and the wind's blowing and you got to move things around. And so just be ready for anything when you're out there. And I think also just, again, everything can be planned down to the nth degree, but everything always needs to be tweaked. And we as volunteers, no matter what role you're in, anything that you can do to make suggestions of how things can be run better, they're always welcomed by the health department staff or the pod management. Again, it's more about just making small changes, making things run better, and be an active participant. And I also just want to say that the debrief, like she talked about, the hot wash afterwards, is really, really beneficial. And to be an active part of that, just to chime in and say, here's what I found to be helpful or not helpful, really made a difference. And when we were doing the flu clinics this year, we had one, the first one we did had a lot of kinks in it. And then by the time a lot of the same people did the next one, we had worked out a lot of the kinks in the hot wash previously. So it's really important for volunteers to to feel comfortable, letting suggestions that they may have shared with the staff. So, and one thing I can say about the VDH and Alexandria in particular, because that's pretty much who I work with most of the time, is that they're so respectful and just are really grateful for all the volunteer hours that all the volunteers have put in, no matter how small or how big. So don't think that it goes unnoticed, even if they may not mention it. It's a busy time for them, but again, they're just really respectful to all of the volunteers, and they're just very receptive to any suggestions you may give. And of course, super receptive to all the help that we're willing to give. So that's from my perspective, as far as a medical perspective goes. If anybody has questions, I'd be willing to take them, or if not, thanks for listening to me.
Thank you so much, Lauren. That was great. So we'll kind of go now to Nathan, who he's going to give us a little bit more of a general support perspective. And they also work together at the Alexandria Health District. So they've actually worked in pods and things like that previously together. So I find that that's especially interesting that they can kind of give this perspective. But Nathan, if you want to go ahead and take over and let us know about your experiences.
Sure. Hi, everybody. My name is Nathan Brunigi. Hopefully you can hear me all right. I joined MRC in April, so I'm definitely a COVID joiner. Just kind of going stir crazy at home, looking for a way to help out in the community. And since then, I work the local COVID-19 hotline, help out a lot of community testing events, and I worked at these flu pods that we had that Lauren was talking about. We did a couple of big ones, and then later a closed one to get the flu out to the community, obviously, but also as kind of a dry run for what we knew the vaccine pods were going to have to be looking like pretty soon, and trying out those processes and figuring out what works and what doesn't in anticipation of that. So I have no medical background. I'm just a guy. The first flu pod, I worked on the decon team. That's something that wasn't in like the org chart that Lean showed, but because we're in a pandemic, the way we did it was the first pod we did was a drive up, and we were giving people clipboards with the registration forms so they could fill it out themselves. And that was great, but that meant we had to wipe down those clipboards and clean them before they could cycle back to more people. So that was a whole team, a supervisor and a couple people working. And then this other pod I did flow. Flow is always like the most important team, because managing the people and how they move around. If it works, everything works. If it doesn't work, it starts to feel like chaos. So there I was in the room where the vaccine was actually being delivered, a long line of people socially distanced. And over on this side where the people that had kids had to go, but then this side where the people didn't have kids had to go, and you had to make sure people were routing to the right place and finding the exit and not crisscrossing too much. So that was lively. And that one too was indoors. So, we were kind of decked out in full PPE. That can be, if you're in PPE, especially a long day, if you sign up all day. So that's the kind of thing where you need to make sure to wear good shoes. They'll definitely have like food and water for you there. You don't have to worry about that, but good shoes, charger for your phone, just kind of come prepared to last a while. So the third pod that I took part in was a closed pod. It was just doing some local public school staff and health department staff. It was done at the health department. So it was a much, much smaller scale. But for that one, they went and made me the deputy pod manager, which was a little bit of a surprise, but that was also a great experience because I got to kind of see the planning process, all the meetings, going on beforehand to set it all up, and then see it actually execute. There was, health department staff as the incident commander and as the pod manager, but then I was an MRC volunteer, and then, the biosafety, the decon supervisor, the flow supervisor, and even some of the other higher roles were all MRC volunteers. So that was a great experience. And I would encourage all of you kind of not to shy away from taking those roles that might seem like something you're not used to doing, because they're going to be needed as the number of pods scale up and up and up with the vaccine. and B, because it's probably not as scary as it sounds. One thing I was really humbled by was realizing how much of the planning goes into it beforehand. And if that planning is there and it's solid, then kind of, keeping an eye on things and making sure it operates smoothly is not as hard. I felt as the deputy pod manager, my job was probably a lot easier than like the actual supervisors of each team, because they were the ones having to sort of observe and modify actions on the ground and how it was going. And all of that is going to get easier with time, because as we start with vaccine pods, everything's going to be new. It's going to be a new location. It's going to be a new process. But eventually, it's going to be the third and fourth and fifth time that you're doing a vaccine pod at that same location. And it's going to get easier and easier. Yeah, I think that's it. I think it's already getting late enough. So I'm also happy to answer more questions if anyone has them. But that's it.
Great. Thank you so much, Nathan. I really appreciate that. Those are great perspectives and points of view. We really appreciate both of you guys for not only volunteering quite a bit, I might add, throughout this pandemic, but all of your support for Alexandria Health District. So additional questions can be sent here to the link that's on the screen. So vamrc@vdh.virginia.gov. I'm going to use the last couple of moments to kind of go through some of the remaining questions. One point that I wanted to especially make is I wanted to make sure that I mentioned, because I don't believe that it was in my talking points previously, was that MRC volunteers are considered in the 1A category. I want to repeat that. MRC are considered in the 1A phase category, and specifically how you would be given the vaccination will likely depend on where and how you are supporting the vaccine, but that is both for the 1A category is both for paid and non-paid healthcare staff, which you guys would be considered the unpaid volunteer staff. That being said, it does not need to be just the vaccinator themselves. It may be support roles in a pod that could also receive vaccination. For more specifics on that, I would encourage you, as you are deploying, to reach out to your individual coordinator about questions specifically to that, just given that pods can look a little bit different from each health district to health district in terms of their coordination and when they plan at what point in the pod they plan to give the COVID vaccination to those that are supporting, et cetera. So those specifics I don't want to get into too much, just because they might change from this presentation to others. Also specifically, want to make sure that you guys know that this is an overview training. You may very well have just-in-time training, and want to make sure that I specifically point that out as well. So when we talked about training a little bit earlier, you will likely have a lot of just-in-time training or training while you are there on site with the pod, specific to what the COVID vaccination would look like. Now, that being said, we can kind of go through some of the quick questions. I know that there's a lot in the chat. I'm going to try and get some of them, but I want to also be respectful of your time today. So I'm just going to use the next 5 minutes to get to what I can. So there's a quick question about record keeping. So there are methods of record keeping. You will likely receive a card or something that is computer printed out based on that VAM system that I mentioned earlier, that shows that you received the COVID vaccination and what type of COVID vaccination on a specific date. And then given that, you will need to keep up with that information and present it for your second vaccination when that is the time to be given. Also, there was a question about whether there would be a different vaccination for the first and second dose. No, if you receive the Pfizer vaccination, you will receive the second Pfizer vaccination. If you receive the Moderna vaccination, you will need to complete that vaccination with a second Moderna vaccination. So there were some questions about the Board of Nursing to reenact nursing license on a temporary basis, and whether or not the MRC can help expedite this. If you're running into problems there, please do reach out at the link provided here, the VA MRC at vdh.virginia.gov. We can try and do what we can. I can't make specific promises just because, as you can see, we have quite a lot of people who are interested in being vaccinators. We already have 311 people who have already gone through some of that initial training, non-COVID specific, of course, but have done some initial training for vaccination. So we anticipate that that number will grow quite significantly, of course, in the next few days and weeks. Specifically, a question came in about the dosing time. So I just want to reiterate that for Pfizer vaccination, it's recommended 21 to 23 days, I believe, recommendation wise for you to get that Pfizer vaccination. And Moderna is 28 days to, I believe, 30 days. That information, again, may change based on what we know about these vaccines, but that's as of right now what I'm aware of for the vaccination. We talked a little bit about record keeping. So again, that's going to be going into the VAMS portal, which will link up to VIS for vaccination record keeping. And that should keep all of the record of who has come for their first and second dose. Also, there's some questions about how would you know whether or not you would have the dose. They are ordering doses based on how many initial ordered doses there are. So if you showed up for a pod on one date, you will be told when an estimate of when to come back for your second vaccination, and then you would return at that date, and there should be vaccination there based on previous ordering. How will we ensure that we get vaccination first and second dose on time? Again, this will be scheduled likely by the health department or the hospital or whoever is creating that pod, and it will be managed in that VAMS system. I can probably take about 2 more questions, so I will go through those. Let me just look and see what I haven't really touched on. This is an important one. Will people be required to wait a few minutes before leaving and after receiving their vaccination? We highly encourage, I mentioned before, at least 15 minutes for the flu shot, for example. There may be an additional time allotment for COVID specific. We are still waiting on some of those specific instructions to make sure to let you know of, but there will likely be a grace period that we ask people who have received that to make sure that they stick around for, just to make sure that there are no allergic reactions. And then there are some questions about vaccination prior to helping administer vaccinations. Again, I would refer you to your local health district specifically about what their plans are for that. And I would really only contact them about that once you have received notice that they are getting ready to deploy. I do remember that there was a quick question in the chat about when we expect to deploy. We could be deploying MRC for vaccination as early as when the COVID vaccination starts. We are prepared to do so. That would be likely this next week. We don't know that we will be necessarily deploying at that time, but just make sure that if you are a vaccinator and you are completing your training for that, just be sure to monitor your phone and your email for any kind of updates as far as that goes. And then also non-vaccinators as well. If you are working in a pod and you've got previous pod experience and you're interested in doing that, just make sure that you're keeping an eye out for your different alerts that come through. Also, just want to tell you all, thank you so much. Again, it looks like we're at the top of the hour. And again, I want to be respectful of your day and make sure that you guys all have time to do some really nice holiday things this weekend. Thank you so much for everything that you've done and everything that you do. Just want to tell you a reminder, if we can go to the next slide. If you are attending today, make sure that you are entering in the Pod Rocks phrase. The link is here on the forms. So you're going to go to this link, click on the form, and then you're going to enter in Pod Rocks because pods do rock. That's how we're going to vaccinate America and the rest of the world, hopefully, too. But we are focused on Virginia. And I want to go ahead and thank again all of the presenters for today and all of you for joining us. So thank you again to Lauren and Nathan. And thank you so much, Lean, for giving all of that really detailed information about pods and SNS and how we are going to be doing this amazing work. And I want to encourage you all that you are all superstars and superheroes in my eyes. This will be probably the largest vaccination effort that I have personally ever lived through, possibly in history. And the idea that you are all, coming forward and interested in assisting us with this is absolutely remarkable. And I want to thank you from the bottom of my heart personally for stepping forward and stepping out to assist your communities. So thank you so much. And we hope that you have a wonderful rest of your day.
Thank you, everyone.